I am Dr. Sadeep. In my channel, I will be uploading videos concerning practical aspects of homeopathy. How to practice homeopathy in a classical way. So I have already done a few videos on this subject, friends. If you are interested in these type of subjects, please like, share and subscribe our channel. So today subject is, I have already done 3 videos on miasms. So in my previous video, I already discussed about facial features of Sora. How the facial features of Sora will be revealed on the face so that you can easily recognize them and find the Soric features on the face. Today I am talking about this psychosis. So this psychosis is also called as red miasm. Dr. Grant Bentley has divided these miasms into different colors. So basic 3 miasms, that is Sora, psychosis and syphilis. First, that is Sora is represented by yellow, psychosis represented by red and syphilis represented by blue. Remaining 4 miasms also been graded by colors. So in future I will be talking of those miasms also. Today the facial features of psychotic miasm, that is red miasm, so we will be taking up one by one. So how the forehead will be, how the eyes will be, how the nose will be, how the cheek, how the ears, and what are the features which represent the psychotic miasm in a patient. So first of all, if you come to forehead, so forehead in this psychotic miasm, the psychotic miasm has a forehead which is straight or which will be more than 12 degree. I will be putting up the photos in between. You just see that and you can understand and recognize in your patients. So forehead will be more than 12 degree deviation will be there in a psychotic patient. So coming to eyes, so will be, these eyes will be protruded. So these eyes will be wide open. So protruding of the eyes is maximum. Exophthalmia we call as. So that will be a feature in the psychotic patients. That eyes will be large. So if you see the face, you will recognize that eyes will be large and protruded. These are the 2 features in the eyes in psychotic patient. So coming to nose. Nose has a ball-like feature in the nose. That is, nose will be having a ball-like feature. So this nose tip will be having a ball-like feature in the psychotic patient. And nose will be also having a cleft in between. There will be a small dent or small partition in the nose, that is called as cleft in the nose. So this is the second feature in the psychotic patients. And third feature of the nose is, nose will be little wider. So nose will be little wider. If you see the total face of the patient, so nose will be little wider, nose will be having dent, nose will be having a this ball-like feature in the nose. So these are the 3 features you must recognize. Coming to lips. So this lips will be little thicker. So lips will be little thicker in the Soric patients. So as you see the total face, the lips will be thick in nature. So if you come to the teeth has around 3 to 4 features. One is, teeth of psychotic patients will be even, so well organized. So teeth will be well organized, and sometimes teeth will be having a gap between the teeth. So if you see the gap between the teeth, it is the psychotic miasm representation. So this between the teeth, some gap will be there, or multiple gap will be there in the psychotic feature, in the psychotic teeth of the patients. So another one feature in psychotic about mouth is, whenever the patient smiles, there will be a showing of gums. So gums can be clearly seen. Gums can be clearly observed whenever the patient talks, whenever the patient smiles. So gums will be observed whenever he will talk or he will smile. So this is the showing off of the gums, we call as, this feature is called as. So in mouth, one is about teeth. Teeth will be well organized and even in nature, or teeth will be having a gaps. Single gap is also a feature of psychosis, and multiple gaps in the teeth is also a feature of psychotic miasm. And thirdly, as I told you, the showing gums. So these are the three features in psychotic miasm. Like to ears. So ears. So in ears, psychotic patient represent two types of features in the ears. So one will be outturned, like, so outturned, the psychotic feature of ears will be outturned, or it will be inward turned. So inturned and outturned, both features are represented by psychotic features in the ears. So this is about ear features of a psychotic patient. And if you look the hairlines, of a psychotic patient, so this hairlines will be having three features. One is straight hairline. As you know that straight hairlines will be there. So this hairlines, if you want to see, you must take the hair totally off and you must see the hairlines. What is the edge of the hairline is representing. In psychotic feature, that will be straight hairlines will be there. So this straight hairline represents the psychotic feature in the patients. And sometimes this hairlines will be coming downwards. So if a forehead is this much, so sometimes this hairlines will be coming here, crowded hairlines will be there. This crowded hairline feature is also a feature of psychotic patients. One is straight hairlines, and second is crowded hairlines, and third is hairline will be coming downwards. So the hairs will be coming in the head also. So these three features will be representing the psychotic features in the hairlines. So coming to the chin. So if you see the chin, there will be a chin ball. So as I told, nose ball, the ball features in the nose. So like that, chin ball will be observed in the psychotic patients. This is called as chin. Chin ball will be there. A well-developed chin will be there in psychotic patients. So that is called as chin ball. And another one feature in the chin is the cleft will be there. There is a small dent here. So cleft will be there in the psychotic patients. This is about the chin features of psychotic patients. So coming to the smile. So this smile will be wide. So the psychotic patient, as you know, he has a wide mouth. Mouth will be very wide. Due to that reason, whenever he smiles, a big smile will be seen, a wide smile will be seen. So psychotic nose and mouth will be little wider. Due to that reason, it comes under psychotic feature of the psychotic patients. And lastly, this lines on the face. So lines around the mouth. So lines around the mouth. Whenever he talks, whenever he smiles, there will be lines produced in between, like lines around the mouth. So this lines around the mouth is also a psychotic feature. And a small line between the eyes. So here a small line between the eyes is also a psychotic feature. So in Sora there will be two lines, one line here, one line here. So you can see the two lines in the soric patients. But in psychotic patients there will be one deep line in between the eyes. In between the eyes there will be a deep line. So this is about the total line, facial line features in the psychotic patients. So these are all the features in the psychotic patients. So today I have talked about this psychotic facial features, how the facial features can be recognized in the patient. Next session I will be talking about the syphilitic miasm, how the features of syphilitic miasm present themselves on the face and we can recognize and take note of. So this is all today, friends. If you like this video, please like, share and subscribe our channel. In future I will be doing such enlightening videos and please share these videos to the medical graduates of homeopathy, homeo medicos, homeo doctors, homeo consultants. This is all today, friends. Thank you and take care.